Hi, everyone. Welcome to Work in the Hospital. My name is Chris Selvaraj. I'm a surgical registrar working in New South Wales. Look, I'd like to congratulate you on making this far, and I'm very excited for all of you in your endeavours starting work in New South Wales Health. Now, as some of you may know, there is a pandemic going on, and over the last 2 years, I think the pandemic has exposed a lot of the issues that have been sitting within the health system for a long time. Now, I started as an intern about 7 or 8 years ago, working at Liverpool Hospital. And although I'd worked in different workplaces, the hospital system was exceedingly complex. And years later, partly through work with ASMOF, I'm learning things that I had no idea about. We are working within, and this is my opinion, a broken system. And a lot of people will find that out in their own way over their years within the hospital system. I think we are lucky, in particular, to have a union that represents salaried medical officers. Now, something that I didn't quite appreciate was that there is a difference between doctors, and you might be asking yourself, why do I need to join ASMOF? Now, ASMOF represents salaried medical officers. Now, those are the doctors that get paid a wage by the hospitals in New South Wales, as well as a subset of other groups of doctors. Now, this is important because we need a union, we need an organization that is able to represent us and have our best interests at heart. Now, after 8 or so years working within the hospital system, I can tell you that I've seen and personally experienced all manner of different issues or conflicts arise in the workplace. And they can be related to unsafe practices, to unfair rostering, to pay issues and difficulty getting leave. You see it all. And I think what you'll tend to realize is that you're not alone in this situation. It's not just you that is experiencing difficulties, and it can be challenging, particularly when you first start as a doctor, to navigate the system and to understand where you sit amongst everyone else in the hospital. And you might find yourself continually reflecting upon your own practice as a doctor, and that should be the focus of your work. However, the workplace and the financial system that sits beneath it is complex, and we are workers working within a system that sometimes doesn't have our best interests at heart. And it's not anyone's fault, but the award is outdated, and there are a lot of gray areas where we could be potentially exploited. Now, what I would recommend to all junior doctors starting work in the hospital system is take a look at what ASMOF does and what ASMOF has done, and have a think about who you want representing you. Because whilst we're focusing on our professionalism, reflecting on our practice and learning how to be good doctors, we need to make sure that there is a collective, a group that with a shared vision that is representing our best interests at heart in an exceedingly complex system. So at some point in time, you may realize yourself, look, things aren't really working very well, and there's no real good reason why the workplace is designed this way, and I might be having my own personal difficulties, and I'm sure it's not just me. And you speak to your colleagues and they're having difficulties too, or maybe they're not. Have a chat to ASMOF and see what ASMOF can do for you, because becoming a member of ASMOF was one of the most valuable things I did for my safety within the workplace.